Good afternoon, everyone. It's good to see you all, even though you're in little small 1-inch squares on my computer. It's good to gather in this way. And my name is Michel Danner. I'm the Associate Executive Director for Church Vitality for Mennonite Church USA. As you know, during this season, the Mennonite Church USA is trying to do equipping seminars that might be useful and timely for the things you're facing as pastors or church leaders. And so you can find past webinars that you might have missed. Those recordings are online at Mennonite Church USA's website. This is actually also being recorded. So if there's some things here that you find helpful but can't quite write your notes down or quickly enough, as soon as this is over, it'll go to our IT folks, and they usually have them up before the end of the night. So thank you for joining this call, and hope that it'll be a fruitful time of engaging with our panelists today. So with that, I'm going to turn it over to Charlene Epp, and she will take it from there. Thanks, Charlene.
Good afternoon, everyone. And each one of us panelists will introduce ourselves in just a little bit. I am going to offer this prayer as an opening for us, and it comes from a chaplain colleague, Claire Hostetler from Cincinnati, Ohio, Village Home Hospice Chaplain. One of the things we get asked to do as chaplains sometimes is provide a reflection or write a prayer, and he did this for the team that he works with, and it was for April 3rd meeting. Dear God, we as a team, as a community, as a nation, and indeed as a world, are in chaotic and ever-scrambling disarray. One microscopic virus is completely upending our sense of normalcy, our comfortable known patterns of behavior, our sense of available daily resources we take for granted, our ability to interact with closeness and to touch without fear. Yet, we are being called upon to continue to offer our care, to communicate our knowledge, to share kindness, honesty, faith, hope, and love, all with a careful, professional approach, and with new rules of separation, 6, 10 feet, maybe more, from those whom we have committed ourselves to support, to listen to advocate for, to journey with into the unknown. So walk with us, dear God, when we retreat into internal primal fears of becoming infected by this dreaded virus, of being deprived of protective gear that will help us survive, of the threat of being isolated from our own family and cut off from friends and fellow travelers on this perilous journey. Cleanse us, heal us, gift us with gratitude, grant us the security of inner centeredness, to see beyond the obvious chaos and anxiety, to be mindful of your abiding presence within, to keep a deep sense of connection and presence with our team members and colleagues, with our patients and their families, and most of all with you. Hear our prayer, O God, our healer and sustainer. Amen.
Amen.
So Jerry is the first to introduce himself.
Good afternoon. You can all hear me. Make sure I have my voice on. Yes. It's good to be here. It's good to see faces. Good to see many faces. This experience with COVID is an isolating experience in many ways. And I thank you for inviting us, Charlene, to talk about this important topic and just be together for a while to discuss the different aspects of grief and death and rituals and those things. I see a lot of people that are familiar to me. I'm a 1987 AMBS grad and worked in the Center District Conference really pretty much all my life. Worked as a youth minister in the CDC and at Camp Friedenswald for a number of years. But my main work has been as a hospital chaplain. I started out in South Bend, Indiana, and worked 15 years at Memorial Hospital of South Bend. In that area, my primary focus was perinatal, working in the newborn intensive care, pediatric intensive care, as well as everywhere in the hospital, including ER, but those were part of my primary focus, and provide leadership with some of the perinatal loss group and bereavement type resources, a monthly newsletter, a monthly support group for those 12 to 15 years. I currently live north of Columbus, Ohio. I work in Mount Carmel Health System. I started out working in the hospital system at St. Anne's in the neonatal intensive care unit, a high-risk labor delivery, and of course all the other areas that chaplains and hospitals get to work around. Worked there for a little over 10 years, and then in the last 6 years, I've been a hospice chaplain for the same healthcare system. Mount Carmel has 3 large hospitals in the Columbus area, probably around 1,000 beds between the 3 hospitals, a level 1 trauma center, if that means much to you. And we have in our hospice program 4 chaplains, and we serve approximately 300 hospice patients and about the same number of palliative care, home care patients. Currently, as hospice chaplains are doing everything remotely, like most of us. I've learned to use the phone much more than I used to. We always called people, but now we're calling them even more. Our hospital system, we have had COVID positive patients, probably, I don't know what the current data is, probably around 75 was how many patients we've had during this course. A few deaths, not a whole lot. One of the things I find in hospice care that we don't get very many of the COVID-19 patients. It's a fast-moving virus, and generally they don't get to our hospice care, or if they do, it's more of an inpatient, very much end-of-life care hospice support. If they do receive, the COVID patients receive care, it's going to be from the hospice chaplain, the hospital chaplains, I should say. But we haven't been doing any visiting of COVID positive patients. Part of it is due to PPE for the protective, personal protective equipment. We're not taking those away from the physicians and nurses that actually have to be in the rooms. The impact for me is mostly in my visits to extended care facilities, nursing homes, and places like that where they restrict visitors, including family. So, for example, working with a family who's a couple who are married over 60 years, and the husband's in the extended care facility, but the wife can't visit him due to the visit restrictions. They will, in some places, let persons in for end-of-life care at the very end, but unfortunately in this situation, she did not get to see him because he died during the night at a different time than when you could visit. So there's a lot of added grief and loss and unfinished things that are part of the experience these days with the COVID. So my hospital experience or hospice chaplaincy, most of my support is with those who are dying and individuals and families during that process. Sometimes it involves service planning, sometimes it involves rituals and grief things, which we're going to talk about some of those unique things in a few minutes. So that gives you a brief picture of my setting, and I'll defer to the next panelist. I think Jennifer is going to tell us a little bit.
Hello and good afternoon, everyone. I'm Jennifer Gingrich, and it's so good to see so many familiar faces. I haven't actually swiped through to see who all is on yet, but I've got my screen of 9 people, and it was good to see people popping on. So thanks for joining us this afternoon. And so I serve in the Pacific Northwest. I live in Salem, Oregon, and my service context is in a small German Catholic town that is home to both a monastery and an abbey. And about 60 years ago, the community asked the sisters at the monastery if they would help care for their old and elderly and aging population. I have been part of this progressive residential care facility for the last 2.5 years, and I work 2 days a week in that facility. We have both rehab all the way to residential living, about 50 some assisted living residents, and then 3 units of about 60 some long-term nursing care residents who live in our facility. We have had 1 COVID-19 positive person in our facility. Thankfully, everyone else has tested negative, and we have managed to not have any spread of the virus, which is fantastic. The other role that I have is I'm a hospice chaplain as well, 2 days a week. And for that, I serve 4 different counties all over the Mid-Willamette Valley, and it's mostly very rural. Going to a lot of small towns and out in the middle of nowhere places where there's no cell reception. And then Salem is the only sizable city that's covered in that service area as well. I, like Jerry, have not cared directly for patients or residents with COVID-19, but as with all of us, have been very affected by it. All of our residents are really struggling with not being able to have visitors. Some literally going crazy, and tending to that grief and need has been huge for all of us in this time. Additionally, hospice patients, like Jerry said, not really having hospice patients with COVID-19, but they are finding family members not able to come visit or choosing not to come visit due to fear of the spread of the disease, either not wanting to give the hospice patient additional health challenges to deal with, or others in the family or community network. So everyone obviously being very affected by this. I have served in congregational contexts, and hospital is where I started in my chaplaincy, and you can read that in my bio. I won't go into more details for now, but I did want to share briefly a story of 2 deaths that I tended to in the last couple weeks. Both happened to be in the facility where I work, and both happened to be also hospice patients. So I got to see them in both contexts. So one of them, this particular individual had lived a good long life, had 14 children. That's not to speak of, she had a couple siblings still living, all her in-laws, grandchildren, great-grandchildren, and even great-great-grandchildren. This woman's decline happened very quickly, and the family was not, for the most part, not able to come and be with her. We waive a lot of restrictions for end of life in facilities, in hope that loved ones can come and pay their respects and say goodbye, and so that the person who is dying can have that companionship as they pass as well. It's an organizational feat, nightmare, if you will, trying to facilitate, especially in that large family, people coming in and out while maintaining appropriate physical distancing and utilizing PPE. Thankfully, we have not run out of PPE here. That's a whole nother topic. But one of the challenges that we faced with the grief process for this family was the funeral home that they were working with could only allow 10 people to be at the graveside burial. And this just broke my heart. Like, how do you choose 10 of your 14 children, not to mention, I mean, the woman was not able to participate in any of these discussions, but as a family, how do you navigate this kind of choice? It was truly awful for them. Not to mention not being able to have any sort of in-person service or gathering. And the question became, do we wait to do something? Do we try to do something now? And hopefully we'll get to talk a little bit more about that in the time to come. But that was one situation I wanted to talk about. And then another situation of family far away. This woman who died just this past week really wanted her closest cousin and her sister-in-law to be with her as she died. She was an only child. Her husband preceded her in death, even though she was early 60s, quite young herself, dying of cancer. And her family couldn't travel from out of state to be with her, which was so hard on them. So spending a lot of time on the phone, connecting these family members to what's happening with her care, representing what I'm seeing, reporting back to them. There's so much more that could be said and so many more stories that could be told, but these are some of the things that we're facing, and we'll for sure have more discussion to come on all of it.
And again, I'm Charlene Epp. I'm currently an intermittent chaplain at Denver Health Medical Center, which is in downtown Denver. It's a public safety net hospital. So it is the hospital that receives the most of the homeless population, immigrants, underinsured, uninsured, undocumented. And I have been involved with now several COVID deaths. The hospital, we have a capacity of around 535 beds. The actual capacity on this past Sunday was about 298. And the reason for that is many patients were moved out to convert units into COVID units and to COVID ICU units. Prior to COVID, we had about a 50 bed ICU capacity on, as of Sunday. That was up to 107. And their hope is to make it up to 150 capacity to respond to what's going on. There were 13 patients, COVID patients on ventilators on Sunday, a total of 61 COVID patients in the hospital. And since March 1, we've discharged about 140 patients. I will say that those numbers were all based on midnight Saturday night. I was on duty on Sunday, and on Sunday alone, there were over 30 COVID patients that were admitted that day, which was more than in any consecutive 3-day period up to that point. The expectation is that we are now thinking we are now in the surge. I'm not sure what that is up for debate. Our hospital did go through a brief period of not allowing any visitors for any patients. And that was changed rather rapidly with a pretty loud outcry. So now one visitor is allowed for NICU babies, or one for patients who need a guardian for decision-making, or one for those who are children and they need a parent present. 2 are allowed at the time of death, or a patient that's dying, but the restriction is that family can stay for up to an hour, And once they leave the room, they cannot return to the room. And that is primarily related to conserving personal protective equipment, which right now we have enough of. Right now we have enough ventilators, but depending on how this goes, we don't know what will come down the road. So those are numbers, and I'll bring a little bit of flesh to those numbers with two stories. One is a patient who did have COVID and died, and one who did not have COVID and died. Matthew was dying of COVID, and his family had decided to withdraw life support. He was a devout Catholic, and the family wanted to have a priest provide anointing of the sick at bedside. But when they learned of the 2-person limit, they determined that Matthew really would have wanted family at his bedside, rather than, in this case, it would have been a strange priest, because we have on-call priests available at the hospital. And so then it became my job to find a priest who would work with that situation. And that resulted in a priest who would not say the prayers over the phone into the room while the family anointed the patient, which I've had the fortune of a priest actually allowing that kind of thing to happen. So what was arranged was that this priest would call into the room onto a speakerphone, but in the meantime, the family had used a tablet that Denver Health has provided with a whole range of virtual options of making connections with family members, so that once the family went into the room, the priest called in and the family could hear him provide a special prayer for end of life, a quite ill patient. When he finished his prayer, the family dispersed, joined in the rosary, spoke it together around the bedside, and then it was just the daughter and son who were at bedside when life support was withdrawn, and they were the ones holding his hands as he breathed his last. It was a very meaningful, important thing for the daughter especially, to be able to be there at that time. The other patient, Maria, was not a COVID patient. She was dying from other conditions, but her husband was in the ICU on a ventilator for COVID. Her son was in another unit, also on a COVID patient being treated. And as it became apparent that Marie was dying, her daughter, who was still at home, came in, and she also had COVID. The staff made an exception because this family was Christian. They were unaffiliated. They had made a relatively recent move to Denver area and did not have a faith community in place. So the chaplain was allowed to go in. So it was the chaplain, it was the son, and then the daughter from home who were in the room at the time of scripture and a prayer of commendation at bedside, and then left the room. And because of their health conditions, respectively back to the patient's room, back home. It was about 2 days later that the spouse was taken off the ventilator, moved to another floor, and about 3 days later was moved to a facility outside the hospital where he could continue receiving medical care. In the meantime, Maria's sister died of COVID, and then the son died of COVID. And when Marie died, the way we informed the daughter at home, the option we had was virtual by Zoom. And she was obviously very distraught. This was actually the fourth family member who had died from COVID. And she was now saddled with the responsibility of letting her father know of all of these deaths that he was unaware of to that point because of the fragility of his health. So those are two situations that I have been involved in. And they speak to a couple of things that we wanted to talk about a little bit in regard to grief, the grief that needs attention at the time of death, the grief that needs attention at the time of a burial, grief that is in the form of mourning for weeks, months, and years ahead. And how does that look for people like this? So I invite now Jennifer and Jerry to speak into some of those kinds of matters. And we want to make sure that we're speaking into things like a cumulative death. And in the situation of the last scenario I provided, this daughter has an enormous amount to unpack, and so does her father when her father is able to unpack the loss of this many family members. So at the time of death, what are some of the things that both of you have found are really important and are challenging in this time?
Your story reminded me of some of the exceptions I make to visits in the nursing home, or when there is a death in the family. And we had a 80-some-year-old woman whose sister died, and she asked for a chaplain to come visit. And part of that was her son couldn't visit her in the nursing home, but I could, because I was part of the medical care team. Of course, I had to use all the gowns and stuff, but and the personal protective equipment, but was able to just sit and let her tell her story. And I think one of the things I just find that we have to be really flexible in how we do that. We of course prefer to be in person, and fortunately I was able to be in that situation. But in another case, we had to use the Zoom. And while I think I first really kind of wrestled in that, it just wouldn't be the same. You've got to be present with the families. I found maybe not even Zoom, but even the phone has been very effective in working with families of hospice patients during this COVID time. The lady I was talking to who lost her sister, they called each other every week. And so a phone call from her son or another family member would be part of her need to help fill some of that void. But the grief gets more complex, and it takes a lot more flexibility on our part as caregivers, pastors, and chaplains to find different ways and creative ways to work with families.
Definitely, and I would say as well, many of the things that we would normally do, we can continue to do, like listening to people's stories. As Jerry indicated, it may not be in person, but one of the things that I did, especially for this woman who passed and her family was, in other states far away, rather than the hospice nurse making the call at time of death, which is what we would typically do. I had already spent quite a bit of time talking with each of these family members on the phone, getting to know stories about their loved one who was passing away. And it made the most sense for me to be the one to make those calls because we already had connection and the nurse didn't have connection with them. And so spending time asking questions about her and giving them space in those moments to tell their stories to really begin the grief work over the phone was really important. One of the things I'm mindful of here as well is that so many of you are in a congregational context and certainly wanting to do visitation to your congregants, especially who are homebound or, truly isolated in facilities and whatnot. And different facilities are responding really differently to the rules and regulations that have been set out. And that's something I'm experiencing even as an essential healthcare worker. There are certain facilities that won't let me in here, understandably, and I respect that. I still am allowed into a lot of facilities and just am very careful and use all the appropriate personal protective equipment. But one of the things I encourage you, if you do have people in your congregations who are dying and you're trying to do ministry to them and or their family, to really have a lot of patience and grace with the management in those facilities, because everyone's anxiety level is just through the roof and they're doing their best to try to keep their people safe. And I think one of the best things that we can do for one another in this difficult time is find as much empathy as we can for everyone, and really work at compassion for each different situation and each person that we encounter. I feel like that's obviously so important right now. Another thing that we talked about as we were preparing for this today was recognizing that many of you may also have encountered scenarios of people in your congregations dying and needing to face doing some sort of virtual memorial service. And we know we're not the only experts here, and look forward to hearing from all of you in the time to come of questions and answers. So yeah, please do, Michael has already said on the chat, ask questions in the chat that he'll facilitate posting those. But we do want to make sure we're speaking directly into your contexts as well.
I think one of the things that has been a learning curve for me is the use of technical equipment, and there are some wonderful advantages to this. And in the one scenario I shared about the Zoom meeting, what actually that family did, because it was Zoom, they chose to have that recorded for the family members who were not able to Zoom in to be a part of it. It is not the same as a gathering at the bedside or in a funeral home, but it does provide a ritual, a familiar ritual with familiar words that in the grieving process is always important at the time of death, at the time of a service, if there can be one, or burial, even if you have to be remote, because here it depends on the cemetery, it depends on the funeral home, it depends on the county, what you are going to be able to do in terms of numbers, presence, etc. But to use those things creatively. And then what I would say is, because this is a complex loss, that the grieving is something that as pastors of congregations, how are you thinking ahead of the times and the ways in which you regather and honor the amount of loss and the types of loss that this represents? And it's manifold, and it can be tended to in so many different ways over the course of time. And the critical importance of attending to grief along the way and not waiting for the right time for a particular event, but attending to grief along the way so it does not become unresolved grief and complicated, unnecessarily complicated grief.
And I think just using our tools and resources, using the phone, making those phone calls, Um, I'm amazed, even as a member of a congregation, um, having we call it the shepherding team. Every 2 weeks, I get a call. How are you doing? How are things going? Those calls are so meaningful, but I think especially for those who are grieving or bereaved, just to make the call to check in. It doesn't have to be profound. It doesn't have to. It may not include a lot of in-depth counseling type things, but at least just checking in to see how folks are going and being really flexible. And in working with facilities, whether it's the hospital or the nursing home, things are changing day to day. I mean, there was one day I could use Zoom, and the next day I couldn't use Zoom because of regulations. And then the following day I could use Zoom again. So let the staff in the hospitals or facilities be part of your team. If there's a chaplain, talk to them. And there may be some creative ways we can get you in the room, if not in person, but there are in many facilities folks that have a tablet or something that they can take into the room and give you some FaceTime with your parishioners or with patients. Those are so important. Just those little contacts. They don't have to be long. Just being visible, being available, checking in.
Definitely, definitely. And this woman who passed without family and friends nearby, one of the things that we were able to offer, because we have provided tablets for each unit for the use of FaceTime, Zoom, Skype, whatever format's easiest for the family. Her pastor was able to visit that way. Her local pastor wasn't able to come in person because of other infectious risk that was at play with this particular individual. But being able to have her voice present, even over the phone or over video, we've found that to be very helpful. Another thing that's so important, I think, is allowing not putting off the grief process. One of the resources that we shared that you have access to on the website where this webinar is posted, I'm not sure exactly where all the resources are posted, but is a webinar from the Chaplaincy Innovation Lab that is about ritual and grief during this time as well. And great webinar that you may also enjoy, and you can watch it on YouTube. The link is there, you'll see it. But one of the things that comes up is that the grief work is important now, and to do whatever we can to facilitate communities gathering virtually in some way is helpful, because people need to be able to tell their stories and have meaningful rituals here and now. It's not that you can't wait and do some other things later. I mean, that happens even in regular times, not facing COVID-19, that people wait for burial of ashes or distributing ashes, but to have some way of people gathering and storytelling. And I set myself up here. One thing you might consider is being really mindful of your location in your home where you do that. So like I, brought some lilacs and lit a candle here to try to make the environment a little bit more intentional where you place yourself, being really mindful of how you set up your space, even as you would if you were in your normal congregational space or worshiping space. So be thoughtful about how you set up visual space as well in this time.
I think that's so important, Jennifer, just our taking care of the visual space, but also I'm also thinking as caregivers, as pastors, how are we dealing with our own grief? And we're kind of in a state of just perpetual, constant grief. Everything is a loss. being with our congregation members, not being able to be out with our friends, and we're all dealing with this at the same time. So part of, I think, managing or being available to grief of others is also finding whatever ways you can to take care of your own grief. I'm needing to be very intentional about staying in touch with my colleagues at work, and we Zoom 2 to 3 times a week. Some weeks it's been more once. Initially it was 2 to 3, but now it's at least once a week where we just kind of check in with each other. How you been doing? What's been difficult? What's giving you life and helping you breathe?
Mm-hmm. The whole piece of both hearing another's voice and being heard is so important, whether you are the caregiver or the one receiving the care. And so one of the things that is encouraged in a lot of the literature for resilience has to do with who's your buddy? Who do you pick up the phone and you can vent if you need to vent, and you can listen when you need to listen? Who are those people in caring for yourself? But I would also put that right beside one of the strongest encouragements I have given over my years of being a chaplain. Do not underestimate what your voice is to any individual. It's not the same if you're not in the room, but arrange it, have it worked out to put the phone receiver or the cell phone up to your loved one's ear or the patient's ear and have family members say what they need to say, the stories they need to tell, whether there is a verbal response or not. We don't know, but the thought is that often hearing is the last sense to go. And so it can be the most important thing for the voice to be heard. So that's whether there's COVID or there's not COVID.
I'll just break in for a second. There's been a couple of questions that have come through on the chat. And one of them is, you've talked a lot about using the phone or other kinds of technology. One question is, are there ways you respond differently on the phone or Zoom than what you would do in person? And they say, I imagine being with simply in silence is more challenging on the phone or Zoom. Is there anything different?
I would say it's definitely harder to gauge what somebody's going through when they're on the phone. You can't necessarily see them or gauge all the emotional response. With technology, there can be a time lag, and that can pose a challenge. But for me, it's actually quite similar. And the more you use it, the more comfortable it becomes, and the easier it is to kind of sink into it as you would in person. I don't know that there's anything I do very differently. And actually, I do really leave silence. I may check in and just say, I hear you, or insert little pieces so that they know that the line hasn't gone dead or something like that. But I definitely still utilize silence a lot.
I think just acknowledging the silence when it's there. I've been amazed how good phone calls have been going. I was really resistant to that at first, but I'm actually finding with some people, at least in hospice, who may decline a physical chaplain visit, have been very willing to converse for a long time, longer than some of my physical visits. Just about what's going on, and there aren't any. There's no magical questions. I guess open-ended questions. Just more checking in. Hi, I'm Jerry. How are things going today? What's going on for you today? And just general questions. And I've had persons just open up, especially being secluded in the homes or being the caregiver, just saying, I am just at the end of my rope, and you just let it flow and follow their lead. And really, I don't feel like I'm offering that much other than my ears. And it's the same as you do in other pastoral situations. And you really, as pastors and caregivers, have all the tools you need. It's just a different time, and it's a different intensity, and we have to use some different means and be maybe a little more proactive, at least I do, in utilizing the tools that I have.
I'm just going to break. So as you do that, how often do you actually talk about that? Like, do you say as you're providing care, I know this is a little different, we're on the telephone, we'd prefer to be in person, or do you just engage them like you normally would in pastoral care? How do you go about that?
I acknowledge it.
I don't apologize or make excuse for using the phone, because primarily they know that they cannot come to the hospital. It's not something that I feel like I have to reiterate. It's right there in front of them. And like Jerry just said, I've had 45-minute conversations with family that I know if they had been present physically in the hospital, maybe some of those people, I might have had a 2-minute conversation.
Mm-hmm.
So it has opened up things in a different kind of a way.
Yeah, and I also don't apologize for it. People are very understanding. And in fact, COVID-19 is like the great equalizer in some ways. It affects all of us, and everybody can relate to it in some way. And it gives everyone something to talk about, like, oh, how are you experiencing this? And how are you getting through this time? And so people are quite understanding. And yeah, similarly, amazing conversation. Somebody put out a question, do you limit time of your calls? Not necessarily. I mean, I definitely try to be respectful of other people's time and try to listen. Are they trying to get out of this conversation? As I would in any pastoral care situation, really try to read what their need is and what the timing is. But certainly I may lament that things aren't different, but I don't apologize for it.
Allison, you asked about communicating with people who are hard of hearing. And I have one gentleman I visit with, he had cancer and he had radiation, which affected his speech. So when I'm on the phone with him, I can barely make out what he's saying. And typically for a while, his wife would be able to kind of interpret it, and it would be between me and him. But we got onto Zoom after it was approved the second time. We got on Zoom, and he was able to talk and speak as well as type out like you're doing in the chat comments, which helped me. And I'll say, James, I can't quite understand what you're saying. Could you type that out? And it really was an effective tool. And I would encourage that kind of, if that technology is available, that kind of help.
Another question that came in, do you have any specific suggestions for online gatherings with grieving families? When they've chosen to wait to have the formal memorial service, do you do anything online, or do you have suggestions for online gatherings?
So I'll give a personal example. A dear friend of mine and my husband died in New York City from COVID. And his wife asked Duncan to do a prayer service by Zoom, which Duncan provided. You can still do the same kinds of things. It's different because they're not in person, but all of the children, all of their spouses, the grandchildren, some of the cousins and nephews and nieces were all present to that prayer service. Will they try to do something later? Yes, they will. But yes, you can do those same kind of things by Zoom. It's going to feel different, and it's just as important.
Charlene, how did that work technically? And were there specific things that Duncan did that really, like in facilitating that space and time, like with structure or order of service or anything like that? Do you know what I mean?
Yes. I don't know offhand what his specific structure was, but he opened it. He had asked ahead of time, is there a particular scripture that you would like? The spouse, the ex-spouse actually, asked for a prayer of commendation. Mm-hmm. So he knew that that was a type of prayer that was going to be a part of the service. They did not try to do singing. Nobody was in a space to be able to do it. But there was not a eulogy, but sharing. And it was just opened up to share what was important to be shared. And it went on for a little while. And it went on for a little while because of the character that Michael was, and because of the deep love everyone had for him. So it was very similar to, I mean, many of us have done this, is you go to the people and what is most important to be a part of this, asking them and then incorporating those into a structure that allows also a bandwidth at times of sharing that is needed.
Okay, a little bit of clarity on the question. It wasn't so much the Zoom aspect, but how do you avoid duplicating like one kind of ritual or one thing with the family over Zoom at the time of death, and then doing the same thing again when they meet together in person? Is there something distinct? Is it like a graveside versus a memorial service, or is there any sort of nuance? I don't know if that brought clarity or made it worse. I'm sorry.
I'm not sure of the question, but if it's, do we do the same thing or repeat things? When we're under a lot of intense grief, it doesn't hurt to do some of the same readings or things. I'm not sure quite what direction that's going, but I find repetition sometimes okay, or just acknowledging that with the family. If you're doing something with Zoom or checking in and saying, hey, we did this when we were on Zoom. Does that seem appropriate or meaningful to you? I'm not sure if that's the direction you're going.
But I would also ask
go
the
ahead.
family. I would ask the family, I don't know what our friends, what they're going to do when the ashes are buried. There may be another prayer of commendation. If you have 19 prayers of commendation, if that's what the family needs, have 19.
Yeah, agreed. I don't think there's any harm in repetition. If they don't want repetition, then that's fine too. And picking different things, certainly. Yeah. But involving the family in the planning as much as they want, would be preferable.
One of the comments I had from one of my staff members, so in hospice you have interdisciplinary teams, and so I meet with them every week, and when I checked into the meeting set and we're doing our attendance thing, and I said, it's Chaplain Jerry, I'm here, and one of the comments one of the staff members make, it's so good to hear your voice, Pastor. I think we need to remember how important your voice is, because it's an extension of your presence. And so I think anything you do, and even in these services, if it's some repetition, so be it. What's most important is your presence and attending to their need. And it's going to be probably more welcomed, especially right now, than you can ever imagine. I think it's especially welcome right now, and encourage you to do it again and again, to make those calls. I'm surprised how important that's been for folks.
It could be as simple as asking, have you had any kind of a ritual or a service? Is there anything about that that you would or would not want repeated? People will tell you what they want and need.
Well, some questions that came through that I don't know that you can really answer, but for the group as a whole, that, you know, are you taking one question? Have any pastors here taken the time to encourage members to do end of life planning now? It seems both really timely and awkward. Yeah, that's a question maybe to think about. I don't know how you would get at that. One of the things, I guess, just to reflect back what I'm hearing is that I hear you saying is that the essential task of what pastors are doing at the time of death and grief and dying is really not changed, right? The way that you do it changes, and the really important things there. One is to be flexible. You're going to be working with staff, with chaplains, with others in a ever-changing environment. There's maybe some things possible one day that aren't possible the next, but human connection is huge. And even if that's over the phone, the voice is really important. Showing up is really important. And don't put it off. Like, don't say, well, we just won't deal with any of this until we get together, whenever that is, at the graveside. Is that a good kind of summary of what your experience has been?
Yeah.
Definitely.
Mm-hmm.
Yeah, and I'd like to point out what Pamela Yoder shared too about College Mennonite. I believe that's where you're still at, Pamela. I hope I'm saying that right. It has a space available for, making services available with live streaming and a lot of different resources that she is pointing to. So definitely check out the chat.
Mm-hmm.
Yeah, and so Pamela is actually doing a video this week too about end-of-life planning and the importance of that, especially now. So
that's great.
Are there any other questions?
This is Allison. I'm just curious if anyone has managed to do something live streamed or recorded from a graveside.
Mm.
I was had a funeral the other week where they, at the graveside, somebody was live streaming it. I wasn't, but one of the family members was.
Well, I also wanted to offer a closing. If there are questions, please share them. I don't know if our contact information was included or not, Michael, but ask questions of us or one another. This is a time to be creative and to be collaborative as well with ideas. I am going to offer, this is actually a poem, and it's by Kathleen O'Mara, and it was written in 1869 after the Irish famine, and it was reprinted during the 1918 to 1919 Spanish flu pandemic. And people stayed at home and read books and listened, and they rested and did exercises and made art and played and learned new ways of being and stopped and listened more deeply. Some meditated, some prayed, someone met their shadow, and people began to think differently, and people healed. And in the absence of people who lived in ignorant ways, dangerous, meaningless, and heartless, the earth also began to heal. And when the danger ended and people found themselves, they grieved for the dead and made new choices and dreamed of new visions and created new ways of living and completely healed the earth just as they were healed.